back from their small groups?
Yes, we're good to go.
And do we have a quorum?
Yes, we do.
Wonderful. Fabulous. Thank you all for being here. So I will go ahead and call to order the October meeting of the Buncombe County Health and Human Services Board meeting. As a reminder to everyone, this meeting of the Health and Human Service Board is a virtual public meeting and is being recorded. So our first item of business is the review of the agenda. So you have all received that. Take a look at it, and I will take a motion to accept the agenda as written.
Move to accept the agenda, Elizabeth.
Thank you, Elizabeth. Can I have a second? Steve, thank you. All in favor for accepting the agenda? Give a hand or an eye. Any opposed? All right. So our agenda is approved. In accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflicts. Please make that known as it is relevant. Thank you. Our next item of action is the review of our September board minutes. You've also received those in your packet. Hopefully you had some time to review. And as if there's any suggestions or comments or edits, I'll take those now. And if none, I will take a motion to approve the September minutes as written.
Move to approve September minutes as written, Elizabeth.
Thank you, Elizabeth. Can I get a second?
Second, Casey.
Thank you, Casey. All in favor of approval of the September board minutes? Say aye. Hands, I see. Any opposed? All right, it is passed. We are moving on to our committee updates and program committee, and we'll start with our Community Opportunity and Economic Benefits Committee, Martha. Martha, you're on mute.
I know.
Okay, very up. You're back on mute. There you go.
Sorry,
Thank you.
my fingers are too fast. Thank you for your patience. Happy October, everyone, and happy almost Halloween if you celebrate. Unfortunately, it's not the happiest of committees because of the government shutdown on top of everything else that's happening federally and trickling down to the states. I asked Philip to try to share some good news to start with. And so here are a few pieces of good news about benefits. Medicaid will continue. There will be no effect from the shutdown. It'll continue until we know what's going to happen to it. But for the moment, it continues. WIC has enough funds to give people benefits through November. SNAP is, quote, business as usual, meaning that Philip and his folks can continue to accept applications, approve them, and also do recertifications, but there are no benefits for November. People will not be receiving benefits November except on the basis of the rolling benefits that they have already gotten. So that'll be it for SNAP until we know what's happening with the shutdown. Something that it was pretty shocking to me, well, shocking but not surprising, is that Philip and his folks have gotten almost no guidance from the feds through the state on what to do or what to anticipate during this shutdown. There's almost crickets coming from the federal government. So that makes it very difficult to do pretty much anything or forecast anything. Oh, one more piece of good news, the low-income energy program, LIEP, which starts December 1st, will continue at about the same level. for now. Philip, do you have anything else that you wanted to add?
I think that that's it. TANF also will continue in November for right now. And that's a block grant. You do worry about that. And the other thing I mentioned too, we've not heard anything about childcare. And usually during shutdowns, childcare is on the chopping block real fast. But so I guess not hearing means we continue as usual. So thank you, Mark.
Thank you, Philip. Philip reminded us that the last government shutdown was in 2018 and lasted about 38 days. It was also during the Trump administration. We're about 3 weeks into this. Sorry to start on this note.
Thank you, Martha. Just another note is that we did emphasize staff morale, and Philip is doing an amazing job at leading his team and guiding his team and keeping optimism and keeping the work in front of them, taking it one day at a time. So just a shout out and a shout of support to Philip and his entire team and all of the staff, and how much we appreciate the work that they're doing in spite of the challenges. So thank you. Okay, so thank you, Martha. Any comments from the or questions from the board? All right, hearing none, we'll go on to our next committee meeting, the community safety meeting. Elizabeth, are you able to give that report?
Yes, good afternoon. Rebecca mentioned that there have been some staffing changes in the adult services division, and that due to retirements and other things, and then so they are realigning staff from other areas of the department to provide coverage in adult services. And the rest of today, we spend time as a subcommittee brainstorming on topics that we want to cover in the new calendar year. And these are topics that, because we're new to the subcommittee, we haven't cycled through yet. So, Steve and I spent some time discussing and brainstorming new topics to discuss with Rebecca. So more to come on that as the year progresses. That's all for us.
Thank you, Elizabeth. Any comments or questions from the rest of the board? All right, we are moving on through our third committee, Community Health. Savannah?
Hey, we also talked about the WIC program. The North Carolina WIC program is operational and open for business. It is important that we keep signing up people that are in need. The state notified us at the current spend rate, we have enough funds for benefits through November 15th. And the county is optimistic that we will have funds continuing after that also. We do have money from the county to continue operations indefinitely. And we did discuss contingency plans to keep our employees on board should things, go longer than we expect.
Awesome. All right, any questions for the Community Health Committee? All right, short and sweet. I guess that's what happens when there's a government shutdown. We don't have as much to say. Talk about. Probably not true. Well, we are working a lot behind the scenes is what's happening. So thank you all. Okay, so we have two presentations that are that are prepared. So we will move on to our child and family specialty plan. Rebecca, you are on.
Yes, hi everybody. Give me 1 second. I'm going to try to share my screen.
We can see your screen.
Okay. Let's see. Okay, when I just changed the slide, are you able to see the change in slides?
Yes.
Okay, perfect. Wanted to make sure. All right, so thank you for the time to just talk a little bit about the children and families specialty plan. This is a pretty big change, and so wanted to make sure that all of our board members had the opportunity to see at least the overview information related to this shift. The Children and Family Specialty Plan is a single statewide plan for Medicaid enrolled children, youth, and families currently and formerly served by the child welfare system. And the intention is to be a seamless, integrated, and coordinated healthcare plan. In a nutshell, what that means is that North Carolina is going from having multiple local management entities that oversee the provision of Medicaid services for foster children and their families to just one plan, which will be Healthy Blue Care Together through Blue Cross Blue Shield. And so instead of having in our area working with VIA to support the needs of our foster youth, we will be working with Healthy Blue Care Together. There are 2 phases to this plan. The first phase is really focused on the children that are in foster care, as well as children receiving adoption assistance, children that have aged out of foster care that are under the age of 26, and then the minor children of any of these eligible folks. That phase will begin on December 1st of this year. So we're coming up on that start date. There's a second phase that will include a much larger group of people, including the parents, caretaker, relatives, guardians, and custodians of those foster children. And then also family members receiving CPS in-home services. And this is that's a large group of people who are receiving in-home services, which are prevention services to prevent children from entering foster care. For this second group of people, they can opt into the Child and Family Specialty Plan. They are not required to join the plan. The first phase of eligible population are required, and they will be auto-enrolled. This slide gives a quick overview of the different types of plans that exist in North Carolina related to Medicaid. And you see the standard plans and the tailored plans, and you see VIA is still one of the tailored plans. What that means is that for children who are not in foster care, that we work with through our continuum of services, those children may still be receiving VIA, and we will have some interaction with VIA around the needs of those children in partnership with the parents of those children, since they're not in foster care. So just to kind of note that VIA is not going away. It will still exist in our community along with other providers, but for our foster youth, we will be working specifically with Blue Cross Blue Shield in the Healthy Blue Care Together program. The Child and Family Specialty Plan is going to be available to children and youth currently and formerly receiving child welfare services, and it's going to be a holistic plan. So it's going to cover all of the physical health, behavioral health, pharmacy needs, any kind of intellectual developmental needs, and really looking at whole person care, I think is the key there. This is just another kind of slide that shows all of the different services. One of the things that we're really looking at right now is that non-emergency medical transportation and access and potentially a new revenue stream that may come from that service. But these are all the kind of resources that will be available under the Healthy Blue Care Together plan. This just shows the timeline, and we just got all of the notices out for our foster youth. So those were delivered here to the DSS office. We had to go through them, figure out where they needed to go, and then the social workers are taking them out to the foster homes or to the providers' homes or locations, so that we can begin to prepare for that auto enrollment of all of our foster youth. And then all of the notices for children who receive adoption assistance went to their adoptive parents. The next step will be that we will get these welcome packets, and then we are setting up meetings with our liaisons to begin to talk about each of our youth and what their needs include. So in Buncombe County, these are the impacted populations as of December 1st. That just gives you some statistics on the number of people that we're talking about. So we have 281 children in foster care, 37 young adults in custody, 512 children that receive adoption assistance through our county, 374 children who have aged out, who are under the age of 26. And then we don't have the numbers on how many children those individuals have. So that's an unknown at this time. There are some exceptions to the auto enrollment into the Child and Family Specialty Plan. And so we're just trying to make sure that we identify any kids that have these exceptions. The main thing is within the IDD the intellectually and developmentally disabled population, if they are on the innovations waiver or a TBI waiver, then they would not be eligible, and they would remain with VIA. This is just a list of some of the services in lieu of services that will be provided under the Healthy Blue Care Together plan for our foster youth. The majority of these are services and resources that we already have access to through our partnership with VIA. So this is not a significant change, just kind of more so reiterating that these services will still be available for our foster youth to access. In Buncombe County, we will have 4 co-located care managers who will kind of work with us in partnership to meet the needs of our children. I think the biggest change in this that I kind of discovered in going to one of these trainings, that is going to be a shift and something that we're going to have to like get used to, is that these care managers will be managing whole person care. We're really used to working with VIA around the behavioral health and mental health needs of our children. So the fact that these care managers are going to be looking even at the physical health appointments is going to be a big change, and something that I think will be a welcome change and something that can really benefit our kids. But it is going to take some getting used to, because we're not used to working with additional folks on meeting the physical health needs. I even heard, and I'm still like kind of holding my breath seeing if it's going to happen, but I heard that they may be helping to make like our initial doctor's visits, making sure all of the paperwork is in order, and helping us to keep track of ensuring that children are receiving appropriate physical health care as well as mental health and behavioral health care. So we'll see how it goes, but it could be really great. So this just kind of shows what that care management process is like, and you'll see kind of in the on the left side in the darker blue there, turquoise maybe, that there are going to be warm handoff and initial meetings. So VIA will be involved in those warm handoffs, and then our staff will be doing those initial meetings. And we have had some good luck in kind of talking through the process with Healthy Blue Care Together and negotiating what is going to work well for us in terms of those initial meetings. So it's been a good process so far. Those new meetings will take place in November, and I'm currently setting up all of the scheduling. It's a lot of kids to get through, so it's a pretty heavy lift in the month of November to make sure that we're prepared for the 12/1 launch. One of the things that I am really, really excited about is just from like an equity slash kind of stigma perspective, is that all of our foster youth and former foster youth and adoption assistance kiddos will now have Blue Cross Blue Shield ID cards for their medical care, medical insurance cards, instead of having to utilize like a Medicaid card. So I think it just kind of is going to reduce the stigma and reduce maybe the way they may be treated differently within that medical system. So that's, to me, is a really exciting part of this transition. There will be a communication hub within Healthy Blue Care Together called NC Care Points Connect. And that's where our social workers will be able to go kind of as a one-stop shop to see everything related to the care that our foster youth are receiving. So we don't know what that looks like yet. We haven't been given any kind of viewing of that system, but it sounds like it will be a good way for us to access information about our kiddos. I included this slide kind of just to talk a little bit about some of the hesitation that we have in making this transition. I don't think that we are hesitant about the Healthy Blue Care Together partnership or the Child and Family Specialty Plan in particular, but the transition is making us a little bit nervous. We don't have a full understanding yet about the specific provider network that will be offered by Healthy Blue Care Together. So for our foster youth, we have about 25 to 30 youth who have specialized complex needs. And some of those children are placed in placements that are extremely specialized. And some of those specialized placements are solely under contract with VIA. And so some of our conversations over the next couple months are going to be about whether or not Healthy Blue Care Together can contract with these providers, or if those children have to be moved. And so some of our worry is just the destabilization of some of our kids in their placements. And this slide shows that we have made some pretty significant progress in fiscal year 25 to reduce the number of nights that we have children sleeping in our DSS office from 130 in fiscal year 24 to 79 nights in fiscal year 25. And so we are just worried that that progress will be impacted, and that we might see those trends go back up. And so that's something that we're just talking through with Healthy Blue Care Together and planning around internally as well. Oh, sorry. So I mentioned this already, but VIA will continue to serve our community. They are partnering with us on the transition of all CFSP eligible children. They will continue to provide the tailored plan and will provide services to the exception populations like the IDD population. They will continue to work with us on our adult services clients, and we meet with them regularly to have intentional conversations to meet the needs of our adult services clients. And then they'll continue to provide services to the child and family population that is not in DSS custody. We've actually had a couple of really intense cases in the last month that did not involve children in custody, and I've been really working alongside VIA to make sure that those children's needs are met. And so those kinds of collaborations will continue. Okay, so that was a quick overview of the Child and Family Specialty Plan. There is more information available if you go to the Healthy Blue Care Together website, or if you go to the link in the PowerPoint. It's basically the Medicaid North Carolina Health and Human Services page. So you're able, if you just Google it, it will come up. So there's a lot of information out there right now, and this is a pretty big transition across the state of North Carolina. So I'll stop sharing and then open it up for any questions.
So Rebecca, do you have did the residential treatment center in Girton, was that established, and has that helped or facilitated the number of complex cases that you were having to house yourself?
So yes, that facility did open as it's actually as a level 2 facility, and they were delayed a little bit. They're now called Blue Rock Behavioral Health. They were delayed a little bit with some storm damage, but they got up and running by about January, February timeframe. And yes, they have been able to provide placement for some of our youth um, who were in need of placement. The partnership is not as beneficial as I think we originally hoped it would be. I think as they've gone through their licensing process, there are some limitations in what how they're able to help and support children with extremely complex needs. But they are up and running, and we are hopeful that they will contract with Healthy Blue Care Together so we can continue to utilize them.
And for the rest of the board, she's talking about residential placement in what we call as a residential treatment center, or sometimes they call it the therapeutic boarding school. And then the most intense would be an inpatient hospital stay. So outside of the acute event of a behavioral or psychiatric emergency in a child, they sometimes need a higher level of care, and that these higher levels of care are hard to come by. And this is just a level 2 option that we now have, but still, it sounds like there's still some gaps there, and more work needs to be done, but one more option than we had 2 years from now, or 2 years ago.
Yes, it's definitely nice having them so close and in our community, pretty much in our community, and it is a good level 2 option. So the way that we kind of frame it is that we have level 2 therapeutic foster homes, we have level 2 therapeutic group homes, which is what Blue Rock is. Then we have level 3 therapeutic group homes, and then psychiatric residential treatment facilities. So those are our placement options, and those are the options that Healthy Blue Care Together will be supporting us with in terms of them building their provider network.
Thank you very much, Rebecca. I really love seeing that statistic that you showed of the nights going down, and so that's an important one to watch as this new transition. But overall, it sounds like this is a very positive change, and with any change, there's going to be hiccups and unintended consequences, so we'll follow those. But it's very encouraging to hear that there's a very significant positive element that we were expecting for this population. So thank you so much. Any other questions or comments from the board for Rebecca?
I have one more comment, and that is in terms of the Medicaid recipients now having a Blue Cross Blue Shield card. I think you probably will need to emphasize for your clients that they do need to identify a Medicaid provider they may be somewhat confused if they have a Blue Cross Blue Shield card, that when they look for services or provider, they're looking for Blue Cross Blue Shield providers. And a Blue Cross Blue Shield provider is not necessarily a Medicaid provider. So there can be a little bit of confusion because of what's on the card. So as they're guided in the process, they need to make sure that they are seeking help with a Medicaid provider, not just a Blue Cross Blue Shield provider.
That's really helpful. And it is my understanding that they will be assigned to a primary care physician, and that's something that we will negotiate when we have these initial meetings. And so that's something that we can keep in mind as well as we're looking at that. So thank you.
Yeah, well, if you, so piggybacking on that, be careful about expecting that they're assigned to a provider that actually will take them. We see that as a big problem in the Medicaid community, is that they're just assigned, but then they call their provider and said, nope, we didn't accept that. Call back and change it. We didn't accept you. So we'll see how that plays out.
Yes.
So thank you. All right, so we're going to move on to our last item on our presentation and updates. David, tell us about the shutdown from your perspective.
Right, and because this is so rapidly evolving, I do not have slides for you about this, but I want to talk through several things. You already heard earlier from Martha and others a little bit about the impact of the shutdown, but basically to help you all understand what's going on for staff and for our clients, we are having to monitor this situation in real time with very little, as was mentioned earlier, we're getting very little guidance. It comes every once in a while in the form usually of just an email. And sometimes there's embedded in some regular call, there'll be some sort of conversation about it, but we're just not getting much information. Not much information is flowing from the federal government to the state. Not much information is flowing from the state to the counties. We did get a notice just today that WIC benefits have been extended. There's enough money in the program based on the estimate of the state of North Carolina that it can continue to operate. And people continue to have new benefits loaded on their cards through November 15th. Now that is for the WIC program. We are still, unless Philip, unless you've seen something new that I have not seen yet this morning, we are not anticipating that SNAP will have funds in November, or am I misspeaking there, Philip?
You're correct.
Right. So this is the big problem for us. And what that means is that come November 1st, there would be no new, this is all absent something changing in the federal government funding commitments, that there will be no new benefits loaded onto people's EBT cards for Supplemental Nutrition Assistance Program come November 1st. Now, Philip and I were discussing earlier today that it seems that if you have benefits on your card that have not yet been spent and November 1st rolls over, your card would not necessarily be turned off, but no new benefit would be loaded onto. And then in terms of dollars, in terms of impact on our clients, there's just a few things to understand. We are contributing to our clients through the benefit cards, whether it's the WIC card or the SNAP card, whatever, somewhere between more than $7 million per month to people's pocketbooks to spend on groceries and food in Buncombe County every month. And that because of the multiplication effects of that on our local economy, that actually adds almost $13 million every month to the local food economy of Buncombe County. Just our SNAP and WIC benefit programs together. Because every dollar we spend there in benefits generates an additional $1.73 on average in Buncombe County's economy. So that works out to be almost $13 million every month. And that multiplies out to be around $155 million every year. So when these benefits stop, that means Buncombe County residents that have been relying on these benefits now have $7 million less to spend on groceries, and our economy has $13 million less coming into it. So, and that is one county in America. There's one county in the state of North Carolina. So it's a real problem for us. It's a real problem for our community if that gets disrupted. We are 21 days into the federal government, or more than 21 days now. We are 3 weeks into a government shutdown. And there's other impacts on Buncombe County staff, on Buncombe County programs of that. We, as an agency, typically receive about $838,000 in federal government revenue every week. And right now that's not happening. And so every week that we're shut down, as far as the federal government is being shut down, that's $838,000 not coming in to the revenue budget of Buncombe County that we were anticipating when we adopted the budget, right? So that's a concrete impact to the county's finances. But the impact to the community is far greater than that. So what are we doing? We are staying in contact every day with our counterparts at the state, our counterparts, in my case, the North Carolina Association of DSS Directors, staying in touch with our other counties just to understand what they're doing, understand what the communications are coming from the federal government to the state or between the state and the association. They're doing an excellent job trying to keep us informed. And then we're watching for those emails like we got this morning telling us, okay, we got 2 more weeks of WIC, right? And, but we're not just doing that, we're also building contingency plans. And so Elizabeth mentioned that we have a contingency plan around our staff, should they need to be redeployed into other work. So that's an example of a contingency plan, but it's not necessarily to be activated yet, but we had to develop the plan. And knowing that we are facing a cliff come November 1st that I just described, we are engaged in conversations right now with our community partners who are operating that food supplemental assistance space, our nonprofit partners and others that operate in that space. And we're working toward trying to have a huddle with them next week to coordinate and develop communications, messages, things like that, and a coordinated response as far as referring clients to other kinds of assistance should they need that referral at the end of next week. So there's a lot of groundwork being laid behind the scenes, as Dan said. We're working behind the scenes with partners like Manna Food Bank and ABCCM and others to try to get ready for November. And Philip mentioned that our TANF program we anticipate is going to be funded through the month of November, but that's a whole nother type of of assistance that is, the longer we go without the federal government reopening, the more complicated things are going to just continue to become. So we're watching all of the moving parts. We're laying groundwork. We're developing contingency plans. We're talking with the people that we need to be talking to. We're outreaching our community partners. We're brainstorming within our programs, and working with CAPE, our communications and public engagement team, on potential messaging that might need to go out, and strategizing on not only what would the message be, but also when is the right time to put it out. So all that work is going on behind the scenes. It's nothing anybody would notice. It's nothing anybody would see. But it doesn't mean that there's not an awful lot of work going on because of this federal government shutdown on our side to try to figure out how to help our community deal with it. And so if you have any questions at any point in time through this process, you're each welcome to reach out to me if you wish. But please be assured that we're working on it. And I guess I'll pause there because people may have questions that I didn't address. And I'd like to just give you the opportunity to ask me whatever you want. And Philip, Rebecca, Ellis, anybody, Sarah Bennett, our WIC program managers here, if I don't know the answer exactly, I will invite them all to share, what they know, because everybody is plugged into different communication channels, but we're all trying to coordinate our work.
Thank you very much, David. One thing that you said, I think is worth kind of really highlighting. It kind of hit me a little bit. Is that we went through a hurricane, and we successfully navigated a natural disaster, but that was all local. And we got a lot of support from all over the country to navigate that. This challenge, every single county in the United States is going to be experiencing the same issues, and you're highlighting the economic impact. So it's not just about benefits to individuals, it's economic impact to communities. That's an impressive amount of impact across the United States in all communities. I think that I had never kind of thought about it that way. That work. This is powerfully challenging for everybody.
I mean, Phil, I would invite you if you wish, but I mean, to be honest, if you really think about it, just boiling it down to economic terms alone, SNAP and WIC are they're some of the best investments government can make, because they multiply the effects. They are a stimulus and a multiplying effect into the economy of every community and every household. But you don't have to be on the spot, Philip, but if you have anything you want to say about that, I certainly would invite you.
Yeah, they, the last figure I saw, I think David quoted as every dollar invested in SNAP, every dollar of benefits creates an economic impact of $1.73 because of the money spent in the community with groceries and grocers and whatever, which support staff and all that. So it's a multiplier. So you extrapolate it out. So if we issue $5 million worth of benefits and food every month, extrapolate that out to $1.73. It's a lot of money that impacts local communities because that money is spent locally.
But it also is a loop, and it can go in both directions. Let's just take a major local employer like Ingalls. If they're receiving a significant fraction of those dollars that are put on EBT cards, and then that revenue doesn't come into the grocery stores, then you run the risk of that decreasing the number of employees, decreasing the number of hours that they're scheduled, which has the negative loop impact of increasing demand for assistance from Buncombe County as they reach out to us for help. So it works in both directions. And the thing about the our work continues normally, right? Our work continues normally. We still have to work the cases. We still have to accept applications. We have to do all those things, but we're not receiving the federal revenue attached to those tasks that we must do during the period of the shutdown. So our people have to work, our work has to be done, but Buncombe County is not getting the reimbursement they're relying on while we do that work. That's another.
One thing, can you clarify? So we always hear that workers, federal government workers on furlough will get back pay, even if they're not working. Will Buncombe County get back pay for the work that is being done that we're not getting reimbursed for in this period?
Well, this doesn't affect yet directly the pocketbooks of any employee. What it does impact is the finance office at Buncombe County. So this, they're fronting money that reimbursement is not guaranteed, and the details of whether they'll get that money back or not in the finance office yet to be determined.
We don't know. We're not sure. Okay.
I mean, unfortunately, you're correct, Dr. Frame. In past shutdowns, we've always received reimbursement back to whatever. This time may be a little bit different. You never know. I mean, you mentioned federal workers. I think a lot of them are concerned they're not going to get back pay. I don't know.
Yeah. So there's lots of unknowns. There are things that are known. We know that we continue to operate our programs normally at the moment. We know from the state of North Carolina that they are committing to us, if they can, they'll give us at least 3 days notice before we have to operate something differently because of an instruction from the federal or state government to us. And what we are trying to do every day with our clients is just meet their needs, do the work, process things, and then prepare. Just constant preparation to give instructions once we have something concrete to instruct people to do, which we don't have today, but we are preparing for being able to disseminate a communication once we know what it should say.
Thank you. Thank you, David. All right. If we have no other further discussion on this, do you have anything further from your director's report?
Yeah, several things. First, I just want to say to all of you that we are blessed. We are absolutely blessed that Ellis and Rebecca and Philip and all of our support staff and the senior leadership team are here, and they're really good at what they do. So while I'm unfortunately having to spend more of my time right now thinking about these other things that are not normal, they are running the show. They're keeping everything going that needs to go. Doing a great job. So I want to say publicly to them, thank you for that. And I'll also let you know that I'm coming up on my anniversary as your new Director of Health and Human Services. My start date here was November 4th last year. So I will get to celebrate my anniversary as a Buncombe County employee in Chapel Hill at the School of Government taking DSS director legal training next week, or coming up after Halloween. I'll be in Chapel Hill for a few days getting that training that I ordinarily probably would have received a year ago, but we had some other issues going on around here, so I'm now getting around to being able to go to Chapel Hill to get that training, and we're building budgets. This is budget building season, so we're doing all the groundwork preparations, things we have to do to allocate funds and right size or assess our programs and try to figure out, are there adjustments we would want to make based on our lived experience of the past year and the way we're configured or staffed or programs needing to be adjusted in some way. There's a lot of behind the scenes work on the budget going on right now. And we're also working with community partners around trying to position ourselves better for some future disaster. We're not asking for any future disasters to come our way, but we want to be better prepared if one does next time around. And Buncombe County just hired a recovery officer to help us with the recovery needs of our community following Tropical Storm Helene. So some of the work that we've been doing can be offloaded to that office. Not all of it, but some of it will. So we're all, as department heads, looking forward to getting that extra help and staffing that's going to come with the creation of that new office. So there's a lot of things going on, but I just can't thank our staff enough, because it's an anxious time for them. They're worried about their jobs. They're worried about all the financial realities. They're having to take phone calls. They're having to meet with folks to discuss their anxiety and worry about, am I going to have food money next month or not? Those kinds of things. We got frontline people that are taking those frontline calls and doing everything they can, but it's a toll. It's a mental toll, emotional toll on the staff. So just know that we're doing all we can as a leadership team to help them feel supported and provide the best calm direction we can give them in this time that's a bit uncertain.
Thank you, David. I'll echo that from a board perspective. We are really, really blessed to have you in the helm. And so congratulations on your 1-year anniversary, making it through the first disaster and coming into the next disaster and every disaster that comes from here. So we are here to support you, and we thank you for your service and the work that you're doing and your leadership team. So thank you. All right, so chairperson's report, last item on the agenda. I'm pleased to say that I'm bringing forth 3 candidates to our board. So we have 4 open positions. The engineering position is one of the positions that remains required. These 3 positions will all fill consumer advocate, community member positions. But they have all been vetted and interviewed individually by the executive committee and are being put forth to the board for full vote. So we will take them one at a time. I'll just give a brief one-liner about each one. You have their bios or their application in the packet. The first one on my screen is Eli Tilley. Eli comes to us as a representative of the youth. We were really impressed with his desire to bring a youth perspective to the board. He is currently serving as a youth pastor at Trinity of Fairview Church. He is very interested in youth mental health. And he's a graduate of Monterey College, so he's been a local person for a while. And so he wants to get more engaged in his community and figure out how to get other people his age involved. So we were thrilled to talk with him and to see his energy and excitement about taking a bigger role. in his community, and we found no concerns that would lead us. So any questions? Yes, Donna.
Yeah, yeah. So I looked at his social media and I found a lot of concerns. I'm sorry to say.
Okay.
He's he goes to the Southern Baptist Theological Seminary, and also his church, they are affiliated with the Southern Baptist Convention. So I think we all know how they feel about gay marriage and homosexuals and so forth. He's a big fan of Charlie Kirk, and he has a podcast called Be the Man, which you probably can figure out what that's about. And I just have a real concern that he has an extreme ideology that I'm just not sure is appropriate for the board.
Thank you, Donna. One thing I will say, I mean, I appreciate that perspective and that information. We did not get into that depth with him. What we do talk about with each board member is their role on the board as being representative of all people in our community, and that this is not a place for advocacy for one political ideology or another, but for a representation that is for the health and well-being of all residents of Buncombe County. And he was very adamant that that is his stance. And so we did talk about that. I will say that I have seen him in action. He is involved in Advent Health and their health and human services there. He's involved in his community, and I have not seen any significant concerns from my experience of him in the community. I'm not on social media, so I don't see anything on social media. So that's just my perspective. So the executive committee did put him forward. So I welcome any other, entertain any other comments or questions about him.
And this isn't a question necessarily about him, but in general, what is the minimum age for board membership, or do we have one? I haven't looked at the bylaws in a minute.
I believe it is an adult, 18. Resident of Buncombe County. Those are the requirements. Any other questions or comments about his application?
I was also not aware of Donna's concerns. Is it possible for us to have a little more time to look into it and talk about it again next month?
So that will be a question for legal. Kurt, how do I handle a motion to table this candidate?
Kurt is not with us today. He had an emergency that
Okay.
he had to deal with.
So I would assume that there could be, I mean, so there's two options here. One is we move forward with a vote, right? So this is being put forward by the executive committee as a candidate to the board, and that vote can go forward. It doesn't require a motion. This is being put forward as a candidate from the executive committee. But it does require a vote. You know, it does require a vote by the full board to move this candidate forward. I will remind the board that we are not actually the appointers of board members. The county commissioners are. So all we do is recommend county board members to the county commissioners. So the next step is if we recommend, then he would go to the county commissioners for a approval and appointment. So they would have another discussion and choice. So that's the normal way we would do this. And so it could be an up or down vote of recommendation or not. I suppose without Kurt's guidance that there is an option to say the board could put forward a motion to table this candidate for further discussion at another board meeting.
It's
That would
easy
be
to,
possible.
I'm sorry, it's easy to see. You just Google him and his Facebook comes right up. You can see everything on it. It's not a difficult search.
Yes, you're correct that you don't have to vote this forward or down. You can table it for now and reconsider if you wish. It's really, but it is a board's decision. What is your pleasure is the only
Yeah.
true
So
question.
you could kick it back to the executive committee with this information to re-look at this, reconsider the recommendation and bring it back next board meeting. That could be an option.
Just a clarifying question, maybe, David, Dr. Frayne. I'm wondering, because to Donna's point, probably people join the board from time to time, not knowing everything about them. I'm assuming that there is a way, if there were like extreme behavior at some point, for that to be addressed later on, even after someone is a board member. Is that correct, or anyone aware?
I think there are ethics of board members. There are rules. I'd have to go back and look at our policies and procedures. But I believe there are board ethics requirements, and there are ways to remove board members based on ethics violations.
Okay.
That is
But
correct.
why even go down that road? I'm just, I go to church. I'm a Christian. I have no problems with religious people, but I just have some real concerns watching his podcasts and reading about him on his Facebook page.
Fair enough. I appreciate you voicing those concerns. So any further discussion, or can I have a motion? Either a motion to put forth his recommendation and have a vote, or a motion to kick this back to the executive committee for further discussion.
I make a motion that we kick it back to the executive committee for further discussion.
Can
I
have a
second.
All right. All in favor? Any opposed? I have one opposed.
I'm
So
opposing just because I think I've kind of heard enough and would just make a motion to vote no at this point, just to make my
fair enough. I
position clear,
appreciate
thanks
that.
to Donna's detective work, but I don't know if that fits in legally, so I'm happy for it to go
Well,
back to
and the
executive
other point
committee.
I'd like to make is, I got asked to be on this board by Linda, and so she knew me and she knew what I was about. This guy just did a Google search. Nobody knew him, or maybe you did. I'm sorry, Dr. Frayne, you might have known him, but it says on his application that he did a search online.
So I'm gonna call order. So we have a motion and a second and a vote that is currently in place. So we have one that is against. Are there any abstentions? All right. So the vote carries to kick it back to the executive committee for further discussion. All right. Thank you. Thank you for that.
Can I just make one follow-up?
Yeah.
And I don't know enough. This is not necessarily about this guy specifically, but we have seen much more with school boards than probably public health boards, but definitely with school boards, with them getting infiltrated. We saw what just happened in, Madison County no longer has a board of health. There's a movement of people to get on boards to
Disrupt,
to endanger us, to make our lives harder, to make our jobs harder. So not saying that I'm totally ignorant about, I don't want to insinuate that about this individual, but that is something that we need to be aware of. I think we've been very lucky. We live in a great community, but ask school boards all over the country what it's like when some, you get my point.
Well,
Yeah.
that is why we have a process. So thank you for this process. This is how democracy is supposed to work, right?
Yeah, yes.
So thank you for this example, this good example of how boards are supposed to work. So I'm going to move on to our second candidate. Our second candidate her name is Jennifer Henderson. She is a nurse. She is employed at Mayheck as the occupational health manager. She has been there for I think 4 or 5 years, and she is quite interested in engaging herself, but is also representing Mayheck onto this board, which the executive committee felt to be very valuable and important too. And we found no concerns that red flags from her application and her discussion and interview with the board. And so we are putting forth her as a board member. Again, this is a recommendation from the executive committee and it requires a second and then a motion for approval. Is there any discussion or questions about her application?
I asked her to apply. She's a good friend of mine and I can speak to her character.
Thank you, Savannah.
Yes.
Any other questions or comments? Can I get a second from for the recommendation from the executive committee for Jennifer Henderson? Martha, count you as a second. All in favor for recommending Jennifer Henderson for a board position, raise hands. Good. Any opposed? Steve, your hand is still up. Are you opposed?
No.
No.
I don't
Oh,
know
his head
why
was just tired.
I don't know where that little emoji hand came from.
Oh, okay, sorry.
I did an actual real life hand raise and brought.
All right, very good. All right, so you are a aye, not a nay.
I'm an aye. I'm trying not to. I'm not stirring the pot.
Any abstentions?
There's been enough of that already.
All right, well, it's good. Well, I have to be careful now. We got some good discussion going on. All right, so the ayes carry. So we are recommending Jennifer Henderson for board membership. The third one, her name is Mary Long. She has a social work type background. She currently is working at Goodwill as their a senior program manager. She is a former member of the DSS team at Buncombe County Health Department, knows Rebecca and the whole team and knows how our system works and is very interested in engaging again at this time of her life. She has some more availability to interact. She is very interested in advocating and representing the disabled population, those with special needs. That was one of her big interests. The board had a good conversation with her, found no red flags, and is putting her forth as a recommendation. Any questions about her application?
Does anyone who is currently working, who is here at this meeting, know her and have anything to say about her besides the executive committee?
I think Rebecca might have dropped off. So she would have been the one who knew her. But we had no concerns from that were expressed after, I believe David might have talked to them about her as well. David, do you have any information?
Yeah, I mean, I discussed it with Rebecca. She did not have any concerns to raise. At least none that she decided to voice to me. If she had them, she did not tell me.
I'm happy to have another social worker. That's great.
Very good. Any other questions or comments? Discussion. All right, so this will require a motion. This is a recommendation coming from the executive committee. It requires a second.
I second.
All right, Donna, thank you. All in favor for advancing Mary Long's application for board membership, raise hands. I see everyone. And any opposed? Any abstentions? All right, so we will advance Mary Long. So we have two board member recommendations to county commission, and we will reconsider and reevaluate Eli Tilley.
Thank
Very
you.
good. Thank you. All right. Well, so the only last thing that I'll say as part of my chairperson's report is that I had the pleasure of presenting the annual report for the board to the county commissioners last Tuesday with the support of David Sweat. I think it went well. We kept it very high level and and not too detailed, but it expressed some important aspects of what the board's contributions have been, really highlighting the board's volunteerism during Hurricane Helene in supporting the staff of Health and Human Services, the board's advocacy for the harm reduction program for smoking education as an alternative therapy for substance use. And then David had the opportunity to express some concerns about our challenges that we see facing, given our main priorities is keeping operations going and sustainable and effective, and the staff, and preparing for the next disaster, and preparing for and continuing with recovery. These were kind of our key points. I think it went well, and it is now part of the minutes of the commissioners' meeting. So that is done for the year. Any last comments or questions from the board? All right, thank you very much for an engaged meeting as always. And I'll take a motion for adjournment.
So moved.
Thank you.
Second.
All in favor, you are free to go.
Daniel, the next
Everyone.
meeting will be the third Friday of November.
Oh, thank you. Krista, please clarify the next meeting. It's not going to be on Thanksgiving, correct?
No, I promise. It will be the third Friday, which will be the 21st of November.
So
Okay.
please put that in the minutes for everyone. The next meeting, still virtual, November
Yes.
21st.
Okay.
Thank you all.
Thank
everyone.
you.